First of all, I want to welcome everybody, not only here, but everybody at our branches as well, that is interested in more wellness and getting healthy. And I want to say a couple things. Number one, I appreciate Kevin's vision about a year or so ago to say we are going to invest in wellness and health for our associates. And then going out and talking to so many people and getting Caitlin, who's going to come up in a moment and say a few words as well, but getting Caitlin to join the organization and do what she's done, it's really transforming life. So it's not just about, you know, something on a sheet that says we have this benefit or we have this benefit or we have this benefit. This is truly something that is changing and bringing a whole new level of awareness to health and wellness, which I think we all agree. I mean, you more than anybody, because you're here, understand and believe in. And we want this to spread through the entire organization and then to our families as well. So thank you, Caitlin, for that. I just want to say just briefly, and then we'll get going, that it's great to have Arman here and his wife, Jamie. They both run PHA together and have done an amazing job building a very niche and incredible organization that really helps people with significant challenges. And you'll hear about some of that today that you and or family members have. And we have this benefit available to really do things for families that are going through things that sometimes they don't have a place to turn. And it is having, as we say, a doctor in the family. So I'm sure I'll talk a little more on PHA and some specific things relating to the heart and other areas today. So I want to thank Arman for that, and Jamie, and Caitlin's going to come up near the microphone over here, say a couple words, and then we will get going. Thank you.
Hey. So real quick, I wanted to say you guys are eating this bean pasta. I kind of was explaining to people over there, but this is black soybean pasta. I know it looks really weird, but it tastes good, right? Yeah, roasted veggies, lemon juice. So this was like a huge swap that I tried to get people to change out rather than normal pasta. Tastes the same, but it's healthier, so why not, you know? And yeah, so I'm gonna send out the recipe. This is being recorded, so you guys can rewatch it, you know, if you wanna go back and look at anything, you know, Friday night, listen to Arman, right? Sounds fun.
I don't want to do that.
So anyway, thank you all for coming. This is such an important topic, and obviously nutrition and health all ties into your heart. And you know, I've really seen the effects of this over a lifetime, right? Because I've worked in long-term care, and this is actually the leading cause of death. Yep. Second, yeah, leading cause of death, right? Yeah. So, you know, any little bit we can learn to kind of prevent and make our lives longer and healthier, why not, right? So anyway.
Great. Thank you.
Yep.
So, thanks for the intro and the invite to Mark and to Caitlin. Thanks for you guys taking your time out to come listen to me, because I'm really not that cool. So, you know, you guys made me think, who's this Yahoo gonna be talking to me? But this is me. So basically, anyway, medical school training at Case Western, and then I went to the Cleveland Women's Hospital for residency, trained at the Cleveland Clinic for Cardiology. And what I did was I actually was the co-director of the training program at UH and at the clinic after I finished. And then for some reason, at some point in time, I got hit with this chronic progressive illness with no known cure, and that's that I was bald. And it's so bad, such a bad picture. You don't even see such a bad picture of me, it doesn't even come up on the screen. I don't know. It's on my screen, you don't want to see it. The other one is the issue I've been dealing with is Parkinson's. So what I want you guys to do is, if I'm mumbling or you can't hear me or you need me to speak louder or repeat something, go ahead and fire out that sign or something. Don't throw anything at me. But give me a sign something, and we'll repeat everything. So basically what I want to do is we want to do a couple things. No. This is PHA. So basically, I founded this company PHA, which is Premier Health Advocates, to address the limitations of the current healthcare system that we had. Fragmented healthcare, redundant healthcare, lack of ownership, 9-minute primary care physician visits, The average visit you have with your primary care doctor is 9 minutes. That's about it. And you can't get much done in that amount of time. But we asked the question, what kind of health care would people get if everyone had a doctor in the family? And so we kind of do some of the things that we deal with over here. Right here. If it's interesting to you, it's interesting to us. And any medical issues. All right, so let me just go over a couple common themes going on. Oh man, I think all the pictures aren't coming up. That's all right.
Bruce, I know Dave's here. Is Bruce here? Kevin, you want to look at it? Are they showing up on? You go to the younger people.
Yeah, showing up mine.
Showing up on yours.
Yeah.
So this presentation oh, so it's not PowerPoint.
No, it's not PowerPoint.
Let's see this.
See, Jim, you're here too. I see Jim.
No, you know,
I apologize for that.
All right. It's so strange.
That's all right.
No, because if we get to this one, it's, oh well, there.
Want to just do it like that?
You good?
Yeah, we'll keep this.
Okay.
Let's roll with it.
All right. You there?
Yeah, maybe.
Mm-hmm.
There we go.
So
That's right.
strange.
It's cool. You guys have a copy of the slides and you'll be able to see the graphics, but they can explain what it is. It's a stethoscope and a pad, clipboard with some questions on it. So you're missing it over there. But there's a couple of common themes that we should be cognizant of when you talk about coronary heart disease or heart disease in general. It's a chronic, progressive illness that if you prevent it in the first place, it's going to be much better for you than if you have to treat the problem. Right? Once you develop the problem, which is coronary atherosclerosis or blockages, you miss the window of your opportunity to prevent issues. Once you have the disease, it makes it much more complicated to deal with. So you want to prevent as much as possible. You want to start as young as possible, and as much as possible, you want to be changing your habits to be heart healthy. Right? So with that in mind, so if you myths about heart disease, one of them too young to worry about heart disease. Not true. Coronary heart disease does not discriminate based on age. It can occur at any age, as demonstrated by this timeline of atherosclerosis. So what you see here is you see an artery, you basically chop off half the wall and look inside and see what the artery has. And ultimately, we end up seeing, my pointer is not working, okay. You end up seeing, as you see from the first decade of life, you have evidence of atherosclerosis. Over here. The rupture of the lining of the blood vessels, the atherosclerosis. First decade, and then the third and fourth decade, about 60% of people, if you do heart casts on people, 60% of people in their third decade of life would have atherosclerosis. 70% of people in their fourth decade of life have evidence of atherosclerosis. So you're never too young for this to occur. Okay? I have a question for you. What do you think the lifetime average risk of developing coronary heart disease in a man who's age 40 or a woman who's age 40? What's the risk of developing coronary disease in the future? Anyone want to give it a shot? A shout out? 50%, yeah, it's about 49% for men and 32% for women.
Well, she's been married to, so she's changed.
All right. Another thing here is another myth is I'll know when I'm having a heart attack because I have chest pain. I'm going to call BS on that one too. Excuse my language. But the bottom line, about 30 patients with heart disease will not have any chest discomfort, chest pain, when they have an event. So they may present with shortness of breath, they may present with nausea, maybe lightheaded, they get referred pain to various areas. They get they're very sweaty. So then all of a sudden, the profuse is sweaty. So there's about a third of patients. This is usually in the very overweight people, diabetics, and elderly. The three categories of people usually don't have chest pain. All right, another myth I wanted to dispel. Heart disease runs in my family, so there's nothing I can do to prevent it. That's also not true. If you start early enough, you can prevent the complications of heart disease. But, it's genetics can't, it's true, genetics can't be ordered, but lifestyle adjustments and prescription medications can significantly decrease your risk. Those with a family history have 1.5 to 2 times the risk of developing coronary heart disease, higher than those without a family history. If your family has a history of blockages in the arteries, coronary artery disease, your risk of developing it is twice that someone who does not have a family history. And so I should blame my father for this. Is easy coronary disease at a young age. I should be pissed off at him, but no, I'm not. It's okay. All right. I don't need to have my cholesterol checked until I'm middle-aged. If you can recall in the timeline I showed you, atherosclerosis occurs at a young age and progresses over decades. Okay, so if you want to prevent the issue, you have to start really young and checking for these risk factors for coronary artery blockages. All right, so we recommend starting at the age of 20 and every 5 years thereafter. And the myth, my heart is beating really fast, I must be having a heart attack. While people with heart attacks can come in with a fast heart rate, it's not the primary way people present usually. People present with chest discomfort. It's like an elephant sitting on the chest with associated shortness of breath sometimes, lightheadedness, nausea, and that's the usual way they present. And the fast heart rate may be a result of what the underlying problem is. If you bump off a big part of your heart muscle with a heart attack, the heart has to increase its heart rate in order to maintain good output, the cardiac output. So I think that's pretty good. So any questions on any myths? Pretty self-explanatory, right? All right, so what is cardiovascular disease and its related conditions? Well, cardiovascular disease refers to the number of conditions of which heart disease is the most common. Right? This is basically, hopefully, other issues that can be secondary to a heart attack or heart disease, but there are also these three here can also occur independently: heart failure, arrhythmias, which is abnormal heart rhythms, and heart valve problems. So, in general, when we talk about heart disease, it's familial and dangerous and associated with the number one risk of death. It's heart disease that we're talking about. So heart disease encompasses the most important aspect of cardiovascular disease and the highest risk. So heart disease basically, it's related to a process called atherosclerosis. Anybody heard about that? Those are basically cholesterol blockages, atherosclerosis. And when the plaques build up, let's talk about it here. This is what happens when you have a heart attack. And heart disease is the result of atherosclerosis, complications of atherosclerosis. Here what you have is a plaque here. Do you see my pointer? No. All right. Well, anyways, there's a plaque. The yellow plaque here that grows over time. And then when it ruptures, it may have blood clot form there, and it blocks blood flow downstream. And you bump off a bunch of muscle there. And so things downstream of a serious, complete 100% blockage, the tissue's dead, basically. There's no way to get that back. That's why it's very important to prevent the disease in the first place. Right? You want to prevent the formation of atherosclerosis first. And if you were not able to do that, you want to prevent the complications of atherosclerosis, which are heart attacks, right? And then subsequently more complications down the road, such as heart failure, which is inability to deliver adequate oxygen and nutrients to the body. And this can be a complication of a heart disease event, heart attack. All right, so it's not uncommon for heart failure And all these things are not meant to be exhaustive descriptions of all these. No, so I just want to show you the variety that you can get with heart disease and related issues. So here, the question for you, anyone know what the difference between a stroke and a heart attack is? All right, a stroke is a neurologic event. It's like a heart attack is a heart event, but they're cousins in that they have the same underlying pathophysiology, which is atherosclerosis and a blood clot for the most part. It's a stroke within the brain, called a brain attack, and a heart attack. Two very aggressive abnormal issues that people with coronary atherosclerosis or coronary heart disease are at risk for. And the reality is, let's say something weird, but quite a cool fact about strokes. And hold on, let me figure it out. Oh, a stroke is like real estate, location, location, location. You know, and that's where you get to how you know what's going on.
So
All right.
I do have one question. So if you have a heart attack, or if you're prone to a heart attack, are you more prone to a brain attack?
Yeah, if you have vascular disease in one territory, you usually do in several territories. So the question was, if you have a heart attack, you're more prone to a stroke. I would say yes, because your risk of having vascular disease in other territories, having atherosclerosis or plaque buildup is real. Much higher than if you've never had a heart attack.
So that means when you eat, like Caitlin said, for heart healthy, you're actually being brain healthy too.
Global vascular health, I would say.
Vascular.
Vascular health. Global vascular, because there's three territories where atherosclerosis occurs most, and one is the blood vessels, peripheral arteries. So something may have heard of, people may have heard of PAD, peripheral arterial disease. That's an atherosclerosis in the legs. Then you have cerebral vascular disease or stroke. That's atherosclerosis in the arteries that feed blood to the heart, the head. And you have heart disease. So those are the big three territories, yeah. And the stroke is the fifth leading cause of death, by the way, as well. With heart attacks is the first leading cause of death. So abnormal heart rhythms, I mean, we don't have to go exhaustively through this because this is giving you a smatter, and I wanted you to have a little bit of an understanding of what variations there are in cardiovascular disease. But when we talk about heart disease, it's really the one that when Fred Sanford used to say, "Elizabeth, I'm coming to join you, honey." Remember that when he joked that? You guys ever see Sanford and Son?
Oh, yeah.
Show Sanford and Son? So when Red Fox would go, "Elizabeth, I'm coming to join you, honey." That's the heart disease that we all talk about. And then you can use the word interchangeably with coronary heart disease, coronary atherosclerotic disease. Those are all related under the umbrella of heart disease. All right, so when somebody says, "Do you have a family history of heart disease?" 9 times out of 10 you have to say no. Even if your parents had a valvular issue or if arrhythmia is not necessarily known to be that hereditary. There's a few important arrhythmias that are known to be hereditary. But I mean, that's kind of like extraneous issues. When we say heart disease, we're talking about coronary artery disease for the most part and related complications. And then heart valve problems, the body has basically the heart was a pretty smart system. Smart pump is a series of one-way valves, keep the blood flowing in a single direction. So those valves get tight, they build up calcium or plaque. You get as much blood through, and if they get leaky, then you have complications of fluid backing up in the system. And you guys understand that better than anybody. All right? Well, HVAC for the heart. All right, so why is it important that we're even talking about this, you know? Why are we worried about this? Burden heart disease. This is the same picture as the other one that wasn't there. Stethoscope and a clipboard. I'm not used to this program, sorry. Yeah, but so what is the burden of heart disease? Well, we've already given you some of this information. Heart disease is leading cause of death in women and men in the United States, accounting for 1 in 4 deaths, about 650,000 deaths annually. It's a lot of deaths. One person dies every 37 seconds in the United States from cardiovascular disease. One person has a heart attack every 40 seconds. This is kind of scary stuff. And about 800,000 Americans have heart attack annually, and a large number, 18.2 million adults age 20 and older, have coronary atherosclerotic disease, or CAD, which results in CAHD. Coronary atherosclerotic disease results in coronary heart disease. All right, so heart disease costs the United States $219 billion each year. That's a lot of money, $219 billion. Okay. So let's think of, that's pretty impressive. What are some risk factors for coronary artery disease? We'll go over the risk for developing coronary heart disease. The question I have for you, what percent of the heart disease do you think is preventable?
It's 80.
Yeah. Anyone else? Any other issues? Any other numbers? 80% all. It was wicked smart. 80% of all heart disease is preventable. So how do you prevent it? What are the risk factors that you can change, and what are the risk factors that you cannot change? The ones you can't change include age, gender, race, family history, and genetics. So you can't change those. They'll be born with them. Age, as you get older, for every 6 years of life, your risk of heart disease is up 1.6 times that. Increases of having a cardiac event goes up 1.6 times every 6 years. So your risk will increase by 60% every 6 years. It's pretty significant. And then if you look at family history, it doubles your risk of having coronary events. All right? And then you have things that you can change, including cholesterol, blood pressure, smoking, diabetes, obesity, lack of physical activity, and alcohol is kind of debatable. It depends on, it's a little more complicated than initially thought. The relationship between alcohol and heart disease, so we'll sit tight and probably we have time at the end, we'll go over it. Modifiable risk factors, we're going to fly through these because it's pretty common. Cholesterol is basically serves important functions in the body. It's cell membranes, basically, and neurotic tissue. It's for health. All right. They call HDL the happy cholesterol. That's good, and then the LDL is lousy cholesterol. That's the bad. The same with happy and lousy. What's your lousy number? What's your happy number? And so there's two sources of cholesterol. In fact, more cholesterol is produced in your body than is brought in from external sources. It's pretty interesting. All right. Now, cholesterol increases your risk for developing heart disease by about 58%. Okay, so if you have a lot of bad cholesterol, it's not good. That's no statement there. And high blood pressure is the pressure of the blood pushing against the arteries during either the squeezing cycle of the heart, which is the upper number in systolic, or the relaxing cycle of the heart, which is diastolic. Systolic is the upper number, diastolic is the bottom number. The number you're shooting for is less than 120/80. All right, less than 120/80 is the goal. And so if you can't hit that goal, you have risk of multiple issues such as stroke, coronary artery disease, kidney disease, and heart failure. So it's called the silent killer because you don't know you have high blood pressure until it's too late. Right? So that's very important. Hypertension increases your risk for developing heart disease by about 48%. Smoking, cholesterol is 58%. Hypertension is about 48%. All right. So, and as an aside, Winston Churchill, before he died, had a blood pressure of 300. His blood pressure was 300. Now the goal is 120. That wasn't too long ago. Like what, 50 years ago, 60 years ago? Yes.
Is it just smoking or is it nicotine, like vaping, chewing
anything that combusts or causes smoke or some vapor to get in your body is deadly to you. So cigarette smoking is abnormal, it's not good, but vaping is also not good. That's been shown to be detrimental to your heart and your lungs. And then the nicotine gum is okay as long as you don't OD on nicotine. You take too much nicotine and you end up doing causing very rapid, fast heart rhythms. Arrhythmias with nicotine. So with respect to coronary disease itself, I think vaping and smoking are both bad. So it's some people say vaping is even better than smoking. I don't think it's good for anything other than making Jewel and company very a lot of money. Making those people rich. That's about it. Diabetes, 80% of diabetics die from heart disease. Diabetes also automatically puts you behind the gun or the 8 ball because it's considered a coronary disease risk equivalent. What does that mean? Well, it means that if you have a prior heart attack, your risk of dying is much higher than someone who's not had a heart attack. But if you don't have diabetes and you have a heart attack, you have the same risk of dying if you have diabetes and no heart attack. So the naive heart in the diabetic is much more likely to have trouble, or as likely to have trouble as someone who's already has a normal heart, has a heart that had an event already. Right, so heart attack, no diabetes plus heart attack is the same as diabetes without minus heart attack. No heart attack, okay? Diabetes is really bad. It increases your risk of stroke or heart attack 2 to 3 times that of someone who's non-diabetic. So obesity, another modifiable risk factor. 40% of the people in America with obesity now. The number just came out, 40%, yeah. 93.3 million adults. And this is body fat, obesity, linked to higher lousy cholesterol, lower happy cholesterol, HDL, LDL, and then higher triglycerides. And complications of obesity include high blood pressure and diabetes. A lot of these factors run in packs too, like a pack of wolves. You know, by themselves they may not be so deadly, but when they get together, they wipe you out pretty quickly. This is interesting. Basically, scientists just discovered a way. There's the fat gene, stinking fat gene. See that? I thought that was funny. So physical inactivity is also a way to hurt yourself and increase your risk of having heart disease. So not enough physical activity leads to heart disease, obesity, high blood pressure, high cholesterol, diabetes can all be mitigated by regular physical activity. So, all right, so physical activity. And the risk of increasing, physical activity increases the risk for developing coronary heart disease by about 22%. So if you're physically active, you have a 22% lower risk of developing heart disease than if you're not physically active. Bottom line, the more risk you have, the greater risk you have of developing heart disease. Quickly, we go over the symptoms real quick of heart disease, or heart attacks. Oh, this one showed up nicely. So the common heart attack warning signs are chest pressure. They often sit on your chest. You have lightheadedness. You could have pain in the jaw and neck, the clavicle, shoulders, arm pain, and shortness of breath. Only the way I would look at someone who I thought was high risk for having a coronary event when they came into the ER or the CCU where I used to work, they'd be having a heart event until I proved them otherwise. Okay, so if you're worried, if you're in doubt, let's say you ask yourself, when should I go to the ER? If you're having symptoms, chest discomfort, shortness of breath, any of the symptoms I describe here, don't wait. Just call 911. What's the worst thing that can happen? You're fine. Best thing that happen, you're having something they can do something about. So we don't need heroes. You guys to stay healthy. Now, this spectrum of coronary syndromes range from asymptomatic to sudden cardiac death. So over the first few days of life, you have asymptomatic atherosclerosis build up. And then what happens is, you have stable coronary disease. What that means is, you have a flow limiting blockage greater than 70% that's causing your symptoms. So basically a supply and demand mismatch. You can't increase the supply because there's a big blockage in there. And the heart demand downstream can change or increase. And if you can't keep up with it, you have what's called angina. Angina is the fancy term for it. Same thing, just pronunciated differently. So, and then so after a heart attack, you have a bunch of issues that can complicate things. If you have a heart attack, then everything can complicate that, heart failure can complicate that, and also sudden cardiac death. So, any questions on that? So how do you minimize your risk? Lifestyle modification works. And condition management is such as addressing your issues of cholesterol, diabetes, high blood pressure, and smoking. What you gotta do is know your risk. Oh, sorry. Let me ask you this, the key. So if you know your risk, you know what your cholesterol is, you know what your blood pressure is, etc. What percent of men, what percent of women will have as their first demonstration of atherosclerosis a heart attack or sudden cardiac death? Not that this is an aside question. Okay, you know, 62% of men, 47% of women will have as their first manifestation of atherosclerosis a heart attack or sudden cardiac death. It means you're walking around with basically, you know, we're taking time bombs, 62% of men and 47% of women. So, I mean, it's scary, but it should scare most people straight, you know?
What's the percentage difference? What causes the percentage?
Usually women tend to have not as high a risk of underlying coronary disease until they hit menopause.
Okay.
So, estrogen is protective. Well, we can always, you know, get estrogen production increasing if you want. But yeah, that's the difference. And also, men tend to be not as tough as women, and they also get women more like atypical symptoms than men. So hard to know there. All right. I know your ideal numbers. So obviously the goals for everybody: total cholesterol under 200, HDL 60 or higher. If it's less than 40 milligrams, if your heavy cholesterol is less than 40, that's a negative risk factor associated with adverse events. LDL under 100 is the goal for everybody, with evidence of coronary disease or even diabetes, because diabetes is a coronary disease risk equivalent. So let's say you say I don't have coronary, you're diabetic, you say, why am I taking a cholesterol medicine? Because I don't have any cholesterol issues. My doctor said my cholesterol is awesome. If you're diabetic, it's increased risk. You have vascular disease, you need to be on an event. I mean, you say you need to be on a medicine. This is a statin. So, blood pressure goals less than 120 over 80 and fasting glucose less than 100. Let's see here, smoking, live tobacco free. So you want to quit smoking. It's linked to 1/3 of deaths from heart disease. Smoking is linked to 90% of lung cancers. Secondhand smoking is just as bad. And what smoking does is increase your blood pressure and heart rate, also known as shear forces in the body. And combined with the risk clotting factor activation that smoking does, every time you light a cigarette, it's like taking a gun and putting it right to your chest and pulling the trigger, playing Russian roulette with your heart. Even one cigarette can do that. All right, so, yes.
What do you say to people that say, I know someone that smoked all their life and lived to be 95? Like,
So congratulations, I would say. Yeah, well, good for you. Give me some of your genes, you know.
Right.
They're lucky.
They might have lived to 150.
I had a 35-year-old pro beach volleyball player when I was training at the Brigham in Boston, and he came in with a massive heart attack. His only risk factor was smoking, and he just lit one up, and he just went down. 35-year-old, he didn't die, but he needed a heart transplant after that. And don't be surprised to see people even younger than that with heart disease. You know, especially diabetes. The one diabetics tend to come in much younger. So I had a 38-year-old woman who had three vessel coronary disease, needed bypass. She was type 1 diabetic. So I mean, it's just, you always think no one's immune to this stuff. You know, unless you have a great family history, long lineage of no one ever getting anything, then I think you got to worry still. Or just do the right thing, you know. Like Spike Lee says, do the right thing. All you got to do is do the right thing. You watch what you eat, exercise, stop smoking, and take care of your problems, underlying diseases. That's all. So smoking, your risk of heart disease will drop. If you stop smoking, your risk of having a heart event decreases instantaneously almost. So it drops significantly after 1 day after quitting. Okay? And then after a year, you decrease your risk by about 50%. And then several years later, it decreases your risk to that of non-smokers.
So is it true you could eventually clean out your lungs after you've been a smoker for a long time?
It's not, damage is done. Yeah, well, once you develop coronary disease, the problem is the reason we want to prevent coronary disease, heart disease, the reason we want to prevent it is because you can't do anything to regress the disease. There's no regressive medicines that will regress the amount of blockage you have. So what you have to remember is, I'd rather not develop the blockage in the first place. That's easier to deal with than it is once you have the blockage. How you deal with that as easily you can't. So no, they have shown though with the medicines, with statin medications, for example, they show stabilization of the plaque, of the blockages. So the blockages are much more stable in those patients, less likely to rupture and cause a heart attack. Hey, well, let me ask you this: what percentage of blockage does someone who presents with a heart attack? What percentage of the blockage was the underlying plaque? 25, 50%, 50, 75% or greater than 75%. Someone presents with a heart attack. Yeah, that's right. Less than 50% is the average blockage when someone presents with a heart attack. That's why sometimes when people end up getting, let's say you get a stress test, you may have heard of this. Someone had a stress test a week ago, next thing you know, he just dropped dead from heart attack. The stress test was normal. Why is that? Well, the reality is you don't have a flow limiting blockage. It's less than 50%. You're not going to get symptoms. You usually don't get symptoms until you have blockage of 70%. 70 or a little more than 70%. So that's someone who's on a treadmill, runs 15 minutes, has no symptoms. It says they don't have flow limiting blockages. They don't have anything in there yet that's severe enough to limit the blood flow enough to cause symptoms. And then what happens is the week down the road, the stressor, and all of a sudden they're dead. I don't want to scare you straight. The reality is it's worse when you see that. I get worried myself. My dad gave me coronary disease. I'm not so happy about that gift though.
So someone could have only like slightly elevated cholesterol, have a stressful event, something stressful happen at work, and then have a heart attack, even though they're not on.
Yeah. The average blockage stenosis back in the 1980 when they did the angioscopy studies. They threw a scope, it's like an endoscope, but it's an angioscope, they put it in the artery, and they went and saw what was the average blockage severity in people who presented with heart attacks. It was 28%. We would call that on a catheterization, we call that lumpy bumpy. Luminal irregularities. Irregularities in the blood vessels, but not severe enough to do anything about. So you see that, you automatically put them on a statin. It's like a reflex. Put on a statin to stabilize the plaque, stabilize the blockage. All right, so this is an aside, sorry. So here is the way I like to help people quit. Smoking patch. Observe that patch to help you quit smoking. Wear it over your mouth. That's a good one. All right, so become physically active. Regular daily physical activity can lower your risk of heart disease by decreasing your blood pressure, decreasing your bad cholesterol, increasing your good cholesterol. You don't have to exercise strenuously, but the harder you exercise, the more benefit you'll get. And AHA recommends 150 minutes of moderate intensity aerobic activity a week. That's 5 30-minute sessions a week. Or you can do 75 minutes of vigorous activity each week. My moderate, good rule of thumb is, my moderate, what we mean is a exercise to a level that's hard to hold the conversation for you. All right, so that's kind of what the rule of thumb for the moderate intensity aerobic activity is. So you want to walk at a pace that's hard to hold the conversation, or bike at a pace that's hard to hold the conversation. That's moderate. You want to go full tilt, you can go vigorous and you need half the amount of aerobic activity, but you can do high impact interval training too, which would also help. You know, what fits your schedule better? Exercising 1 hour a day or being dead 24 hours a day? That's another good one. Eat a heart healthy diet. This is very simple. Keelan brought in some nice heart healthy snacks. Heart healthy doesn't mean flavorless. It means you can still make very good food by eating heart healthy. These are just kind of guidelines. You know, vegetables and fruits, beans or other legumes, etc., etc. But the DASH diet, there's two diets here that have also been shown to be heart healthy. One is the DASH diet, which was the what you call it, the one that dietary approach to stop hypertension, and then the Mediterranean diet. And all the others say eat healthy, a lot of healthy stuff, and don't eat a lot of other bad stuff. Salt, sugar, processed carbohydrates, saturated fats, trans fats. That's kind of what you don't want to eat. There's some fat facts for you. Saturated fats increase your LDL. Trans fats increase your LDL and decrease your HDL. And whatever trans fats are formed when liquid oils are made into solid fats. That's not, and find trans fats in many normal things. I saw a box of crackers upstairs earlier today. And in the main room up there, I was thinking, man, there's some trans fats over there. So, packaged cookies, packaged baked goods, crackers, commercially prepared fried foods, these are all associated with high amounts of trans fats. Hey, reduce fats, low fat and skim dairy products, eat lean meat, remove the skin. Very simple to do, you know, you remove the skin, you know, watch for hidden salad. There's no hidden fats in salad dressings, gravy, processed foods. And you want to use real healthy fats, canola oil or olive oil, which are monounsaturated fats, I call them. Here's kind of like a recommended amount of fat intake for a heart healthy diet. 30% of calories or less for total fat, saturated fats. 10% of calories, 2 grams or less of trans fats, monounsaturated fats. Cholesterol less than 300, sodium less, 2,400 milligrams in sodium instead of, you know, people used to say, amount of salt that was allowable was 4 to 6 grams a day. So now they got it down to 2.4 grams a day. And 25 to 35 grams of fiber.
Is there a difference in salts? Like, is it any worse to eat table salt than it is to eat sea salt or kosher salt?
I don't think so.
Salt is salt.
Salt is salt. One is iodized and the others are not. So, salt is salt. So here's, if you like KFC, guys, here's how you can eat the chicken breast. Take the skin and the breading off, And then you can eat it. 190 degrees, you save 190 calories. Say 12 grams of total fat. Say 5 grams of saturated fat. 55 milligrams of cholesterol. And sodium by about 610 milligrams. So the only way it's okay to eat KFC is you take the skin off and the breading. Yeah. Yeah. Best if you don't. That's the best if you don't. If you want to develop coronary disease. But watch your weight. So being overweight, especially around the middle, increases your risk. Heart disease, you got 40 inches for men, or 35 inches for women. That'll increase your risk. And it doesn't take much weight loss. It takes 3 to 5% of weight loss. It helps decrease the fats in your blood. Triglycerides go down, sugar goes down. And then if you lose even more than that, you can blood pressure will go down, and so will your cholesterol level. So it's very important. Lifestyle modifications are very important. Manage your conditions. Work closely with a healthier team. High blood pressure, high cholesterol, diabetes, many conditions who can put you at higher risk. And many of these conditions can be prevented by managing, eating better, getting active, losing weight, and not smoking. So it's amazing, you know, we've come full circle almost, not full circle, we've come a long way since the 20, 30 years ago when they just thought that coronary disease was going to be inevitable and nothing you could do for it. They started looking in the 90s with the statin trials, and then in the early 200s, sorry, 2000s. Basically, that showed that, you know, you can prevent coronary disease. So that's essential. Well, you take all your medicines as directed. Build a prevention plan with your teammates, the team members, like, you know, Caitlin. You recall and say, hey, you help me figure out what I should not be eating, that kind of stuff. Talk about challenges in your life that may affect your health. Stress, sleep, mental health, family situations, tobacco use, food access, social support, whatever else that will induce you to get be less than healthy. So, and this is how you get in touch with us. All right. I think that's it. I'd be happy to answer any questions.
I have a few.
So when we typically do our wellness visits every year and you get your blood draw, you hope that your cholesterol is checked every 5 years. Does the hospital record that every 5 years, or how is that done with the wellness visit, your blood draw? How is that cholesterol checked over that period?
I don't know much about how the wellness program works.
Usually you have to request it. Last time I went, I had to request a cholesterol, like, lipid lab, blood lipids, yeah. I don't know if it's only covered every 5 years. I check mine every year. I think that's the best way to gauge, hey, this year my cholesterol's 5 points higher. What did I do last year that might have caused that? And vice versa, you know, my cholesterol is great this year. What did I do this year that's, you know, making it look better? So I really think you should do it every year. But, you know, maybe only with insurance, I know it's covered every 5 years.
And then,
That's it, it's not part of the preventative wellness CBC panel, yearly, so it would be something based on time frame.
You should ask for that then.
Yeah.
And if you do, there's like, separate lab draws you can do for LabCorp, and it's cheaper with your doctor. For me, at least, it's like $80. Like that's the LabCorp $20. So.
and then in Northeast Ohio, if your doctor's affiliated with the Cleveland Clinic, as an example, then all your information will be on their called My Chart. So all of that is a permanent record. So then next year, as you get it checked again, all your records it's right up there in your chart.
So even though you're
It
getting
stays
blood
permanent.
work, you may not be getting this side of it done.
Right.
Sometimes you have to request it.
Does your cholesterol go up just from aging alone, or is it more diet related? It is what it is. Like as I get older, am I more prone to? Like mine's
No,
gone up as
so-
I've gotten older. Okay. It's not. It doesn't go up according. Like
I would think
gives you more
that
risk.
depends on what your levels are, and how your liver's functioning. liver makes 65% of the cholesterol in your blood. So as you get older, usually the liver backs off, does not work as well as it used to. So you should not be able to make as much cholesterol. The more, maybe between more and the good. I mean, the bad. Yeah. Not the good, bad, and the ugly, but just.
We've got another couple questions. Joy and Jim.
Are cholesterol levels at all a genetic thing, like heart disease?
Yes.
Okay.
You can't be.
Arman, I have a question. We get mailers from companies that do vascular screening using ultrasound and blood pressure together.
Right.
Is that worthwhile?
I would say it's worthwhile for the people doing it. Yeah, I don't think. I think that it's more of a money maker than it is a beneficial thing because what they do is they may do carotid artery, intimal medial thickness, the carotid artery stuff, maybe peripheral arterial disease. It's good to know that, but you can do a simple test in the office. Your doc can do an ABI, ankle brachial index for which insurance covers to screen for peripheral vascular disease. And the carotid intimal medial thickness that is supposed to correlate with heart disease has never been shown to be correlated that strongly anyways. So if you have spare funds and you want to do it, that's reasonable. But
If you want to make a donation.
yeah, a donation to their retirement fund.
Right.
But yeah, it makes the person who gets screened done feel better though. Yeah, so I mean, they had some benefit in that, I guess.
I have a question. I have a condition where I'm supposed to increase my sodium, which is so counterintuitive. So what is the best way to do that without overdoing it? Or is there the more natural way, or should you receive your sodium in a particular way if you have to increase it?
I don't think there's any difference as long as you get the sodium up. In addition, so I mean, I would just they have salt pills that they give. Sodium pills that your doctor can prescribe for you.
Just had to increase my sodium in my food intake.
Yeah. There's a lot of things that have a lot of salt in them, like breads. A lot of bread has high salt in it. Processed foods, like deli meats also have a high amount of salt. I think if you add some salt, what I would do is I would just get salt pills and put them in water and drink them. Drink it up.
Request those. I don't like salt.
Yeah.
Arman, your slides were excellent. Are you willing to share them with us so we can share
Yeah.
them with our teams?
Although Jim's graphics didn't appear. They were great.
We'll figure that out. We'll figure it out. We'll figure it out and we'll get the slides.
Okay.
Great, because the pediatrics on Caitlin, they were all there. But
Yes, they are.
Yeah, it's the PDF.
apologize about that, I'm not sure.
Yeah, you can send the PDF around. Yeah, absolutely. You're more than welcome to have them. Thank you for having me. Appreciate it.
Just before you guys head out of here, I just want to say a thank you really quickly. Caitlin Immunitis, hey, pop real quick. Just want to give Caitlin a big thank you for setting this whole thing up. Jamie and Arma, I want to give you guys a big thank you for coming down. Like my dad said earlier when we started, all associates, your well-being is so important to us, and that's why we're investing so much so that you all have the tools and resources. And like Arman said, 80% of cardiovascular disease and death is preventable, which is pretty amazing. And it just made me think, you think about like the coronavirus right now and how much press it's getting and how people are talking about it and thinking about it for what's about 100,000 cases at about a 2% mortality rate. So you got about 2,000 deaths. With heart disease, 674,000 deaths a year. This is really. That's in the United States.
Yeah.
Oh, I'm sorry. Yeah, so coronavirus is worldwide. 2,000 deaths. Again, horrible tragedy, but 674,000 deaths in heart disease just in the U.S. alone, and 80% of them are preventable. So a quote I really like is, "You dig your grave with your fork and knife." So our choice, So our choices are entirely ours, and we have the resources like Caitlin and PHA to be able to help you through your health journey if you want to start making those changes in terms of diet and exercise. Because and one of the myths that I didn't see up there that I think we probably could have put was that it's too late to start
Never too
making
late,
changes.
yeah.
Never too late. So lifestyle changes, disease management, that's what Caitlin and PHA are here for you, so that you never have an event such as a heart attack or something worse. So that was all I wanted to say. Thank
Thanks,
you.
bud.
Thanks. Appreciate it.